Hi friends, welcome to Diagnox. Today we would be discussing an interesting case of a periapical lesion in maxillary anterior region. We would look into the cone beam CT scans and look into the anatomic aspect of these lesions, whether these lesions are involving critical structure and what are the technical anatomic consideration in maxillary anterior region. So this is a panoramic reconstructed image where you see two periapical lesions which are related to the central incisors, that is 1-1 as well as 2-1. There is a prosthetic crown in 1-1. Let's move on to other slices and to see whether these small lesions involve the anatomic structure. What is the status of buccal cortex and the palatal cortex related to these two teeth? So we would move on to the MPR slices. First we would go through the axial slice and you can see the root end region of 1-1 as well as 2-1, and you can see significant bone loss surrounding the root end region of both the teeth. Now we would move on to the coronal slice. So I have already oriented it towards 1-1. You can clearly appreciate the crown which is seen in 1-1. You can see a patent canal both in 1-1 as well as 2-1. You could see some sort of external root resorption in both the teeth 1-1 and 2-1. You can see the root apex being open, and you can appreciate a well-defined periapical radiolucency in 1-1 as well as 2-1. The radiolucency in 2-1 is slightly larger than 1-1. If we would measure the dimension, the lesion in 2-1 measures approximately 7 mm. The lesion in 1-1 measures around 7 mm. So to radiographically call a lesion as a periapical cyst, it should be more than 1 centimeter in dimension. So definitely we cannot call these lesions as periapical cyst. This is probably a periapical granuloma, and an important anatomic consideration is the presence of incisal canal, which is seen on the palatal aspect between the central incisors. And this lesion, especially the lesion in 2-1, which is very close to the incisal canal, and actually it's involving the incisal canal. So this is one of the important surgical consideration. If we are planning to do a surgical enucleation, the incisal canal should always be considered and given importance, and not to injure the incisal canal because it has got the nasopalatine nerves and vessels. So moving on to another important anatomic consideration is the nasal floor. You could see that this lesion in the anterior region in the root apex of 2-1 is very close to the floor of nasal cavity. If we could measure, the thickness of nasal floor is less than around 1.4 mm. So if we are planning to enucleate this lesion, there is a possibility of perforation of nasal floor, which should be considered, and a particular surgical procedure should be done with extreme caution. So stay tuned to Diagnox to visualize many more interesting cone beam CT findings, interesting findings related to pathologies, TM joints, etc. If you like this video, kindly subscribe to our YouTube channel Diagnox. Thank you.